Hello, everyone. My name is Rosalind Young Daniels, and as you know, I'm president and founder of Black Health Matters. I am just so thrilled to be here. So I'm going to do the best I can to limit what I have to say because my heart is so full to be able to have Dr. Elnahal, Vivica Fox to come to speak with you about her advocacy for breast cancer and a breast cancer warrior, Bershan Shaw. What else can I share? But let's get started. Dr. Elnahal, we know that you work with the medically underserved and so many women and men at within your institution in Newark. What do you want to open up and say about breast cancer today?
Well, thank you so much, Ms. Young Daniels, and to all of my Black Health Matters colleagues and friends for putting on this incredible conference. It's so important, and it's such an important topic we're discussing now. And I'm so humbled to be on the same panel as Ms. Fox and Ms. Shaw, just incredible advocates for this issue. I'm going to share my screen just to begin talking about some important issues here. And I think some of it needs to be sort of best explained through slides. And if someone could just tell me if they see the slides here, I'd appreciate it.
We do.
Yes, I can see them.
Great. So I will start here by going right into it. Just give me a second. Okay, I'll just do it this way because I can't figure out how to start the slideshow. So breast cancer in Black women, it's really important for folks to understand the scope of the issue. And the bottom line is that Black women have a lower incidence of breast cancer than white women and yet have a higher death rate, which is really a shame. And it's a sign of a lot of things, baseline disparities, just inequities that people see every day. But they're also more likely to be diagnosed with late stage breast cancer than other races and ethnicities. And in fact, the really bad forms of breast cancer, like triple negative breast cancer and inflammatory breast cancer, are just more common in Black women than the general population. They're also more likely to have problems with health insurance and healthcare access, and that gets to our design of our programming targeted toward getting more and more Black women access to critical screening and care. This is a chart that just shows pretty simply that white women throughout the country just have a higher incidence of breast cancer, in other words, more commonly. But if you look at the darker pink bar here, that's the actual death rate from breast cancer. And so even though Black women have a lower level overall, they die more often. And you see other ethnicities and races here who have lower, but also just have a lower death rate. So important to highlight that as a major issue. And so how are we trying to change that at University Hospital in Newark, New Jersey? We have a comprehensive breast program that extends access to everything we have, all the best technology, all the best standards of care, and the best doctors in New Jersey, and I would argue across the country, for the care that they get. So breast navigators, genetic counseling, state-of-the-art reconstructive surgery after they get a mastectomy, or other types of surgery. And we've invested in incredible technology, including the Breast Imaging Center with some of the best and latest technology. We also offer clinical trials, which can be a source of hope for so many, but also helps us better understand how to address this issue in Black women and Black men across the country and across the world. And we, of course, get all of the team together to come up with a treatment plan for our women. And of course, we're also involved in screening. We have something called the SAVE program, which is a state-funded program that offers mammograms and diagnostic testing to uninsured individuals who live in our county. And so we end up doing over 60 patients a week through this program. These are women who often don't have another place to go because of their lack of access to health insurance. We also have a cancer health educator, and we also have a mammography van that goes across the city and across the county to screen women closer to where they are. But a big part of this is about raising awareness. And we have so many events that we do in the community, just like this one, but more local and more targeted. We have a Test Treat event every year where we screen for other women's cancers, not just breast cancer. We participate in the breast cancer walk. We have a breast cancer breakfast and celebration. We have a masquerade ball that just happened this year. And we have an employee mammography day, which is actually going to be this Monday, where we focus on our own family at University Hospital and make sure all the women we have an opportunity to be screened. And here are some pictures of that you may notice. This one right here in the bottom left. She attended and you attended, and we're so grateful for that, our event in celebrating survivors and celebrating women and their awareness of breast cancer. This is a picture right here of my own mother-in-law. When we walked into our event for breast cancer survivors, she had a whole hallway of applause celebrating her journey and heroism. And it meant so much to me because I met my wife while she was going through breast cancer, her own mom. And I had a front row seat at that, in addition to being a radiation oncologist myself and having treated women with breast cancer. I got attacked by a T-Rex at our mammography masquerade ball. That's our Central Ward Councilwoman. And that's my timer. And of course, our Alpha Kappa Alpha sisters were there too, giving care packages. But being there for the community is so, so important. And raising awareness is often the best thing you can do. And my co-panelists are just so good at that. And I'm so thrilled to be here. Thank you so much.
Terrific. Thank you for that.
That was lovely.
Isn't that great? So I have to ask, in terms of advocacy and your story, Bershan, please start. Where were you when you received your diagnosis? Where were you and what did you do? What was your reaction?
Wow. So I'm a 2-time breast cancer thriver. Thank you. I got diagnosed the first time in 2007, and I did what no one should do not follow my footsteps, because I was so embarrassed. I didn't want to be known as the sick girl. I didn't want to tell anyone, because I was just like, I'm so young. I'm 33. Why did this happen? Wow. And I was so embarrassed, right? And so in New York City, living my dream. And 2 years later, it came back and it spread stage 4. And oh my God, I remember it to the T. I had horrible back pain. So I couldn't move. I was trying to pick up things and it got worse and worse. And I was like, what's wrong? I went to every type of doctor, chiropractor, shrink, everything. Wellness clinics, all around. I didn't know. And let me tell you, I got an open MRI. And let me tell you, do not get open MRIs, because it's true. They don't read the best. I got an open MRI and they told me it was a slip disc. So and then I kept going back because I couldn't move. And I was like, it may be something. Then I remember the day, in 2009, the doctor told me to sit down. And no one wants to hear sit down. Right? We don't want to hear those words. And the doctor said, what's happened is the cancer has spread from my bones to different parts of my body, and it's terminal.
Wow.
Yeah. He said it was terminal, stage 4 breast cancer. He said it's incurable. And I remember the day, I'm like, what?
Were you by yourself or were you with a friend?
So no, because I thought I was just going to hear a slip disc. So I went to the doctor to go, and I was with my fiance at the time, and my stepmom. We were on our way to lunch, but we had a lunch right by Columbia Presbyterian. So I'm thinking, oh, they're going to tell me a slip disc and take this medicine and da. And he said, I'm not sure you're going to go somewhere right after this. So, I was like, okay, what? And it really changed my life, right? That moment, when someone tells you have terminal breast cancer, what you're thinking was a slip disc was really cancer that went into your L4, L5, different bones, organs. And I was shocked. Stunned. I don't even know. I was just stuck. And I really just needed a moment. And I said, give me a moment. So I remember going into the hallway because it was so much information and you always need to take someone with you. Don't go by yourself. You need a friend, a supporter, someone who can record something because it's a lot of information. And I just said to God, and I got on my knees and I said, God, if you keep me alive, just keep me alive. I will motivate and inspire women and men all around the world, in their cancer journey, in their life journey, because I know this cannot be my journey. Like that I'm just going to die right now and, in 3 months.
Right.
And here I am, 12 going on 13 years later, cancer free, no evidence of disease.
That's fantastic. Fantastic. All right. Now, listen, I'm just going to pivot 1 second. I want to also hear Vivica's story. What brings you to your advocacy?
Well, I actually have a couple of stories, but I'll make them very, very brief. I had a friend named Shelby that I remember that when I was younger, she passed away. She was 36 years old. And she left her husband and daughter. She thought she got past it one time and then it came back. Also, Richard Roundtree, who I worked with on Generations, on several movies. As a man, here's this amazing sex symbol. He was diagnosed with breast cancer as well. And so I never knew that breast cancer could affect men. So, to hear this strong man tell me that I'm a breast cancer survivor was just like so enlightening for me and educational as well. And then also the Vivica Fox hair collection, which you all know, I thank y'all all for buying some good hair. Thank y'all very much. But we also give back to the community and those who are affected by breast cancer. We donate wigs to women in Philadelphia that are going through chemotherapy. So I am a supporter. I am also here as a celebrity to lend my voice and my name to bring awareness to our sisters, to don't be afraid to go and get your mammograms, to speak up, to communicate with each other. All of you all being here today, we hope that we can drop some gems and some courage and encouragement to you to make sure that you take care of your bodies. That's what this is about today, is us sticking together and educating one another.
Thank you. That is so well said and so well felt. Dr. Elnahal, what can we say about screenings today? Am I going to come to you because I felt a lump, or do I just need to come just to have a mammogram? And what happens when some people get a mammogram and their cancer is not diagnosed, it's not detected? Speak to us about those scenarios.
It's a really important question, Ms. Young Daniels. And I think it's important to understand that in Newark, we still see too many women coming in to our emergency room, to a clinic appointment when they're already feeling a mass, saying, hey, I'm feeling this, I'm worried. And they're diagnosed at much later of a stage than they otherwise would have if they got their mammograms. Folks, these mammograms can save your life and will save and do save so many women's lives every year. And the importance of screening is just, I can't even emphasize how important that is. We have to make sure that we extend access as much as possible to women, regardless of ability to pay, regardless of their jobs, regardless of any of these things that have kept women back for so long and their health care. Screening should be a women's right and a human right.
Yes.
And we have to do more. Mammograms aren't necessarily the best way of screening for every woman. In fact, we already talked about breast MRIs for particular women who may have very dense breasts, or for a different reason, it would be hard to distinguish between something cancerous and something not. On the imaging, your doctor is the best person to determine that. And so in addition to connecting women to mammograms and screening MRIs, we're trying to connect these same women to doctors so they can be followed over time, even if it's a false alarm, even if there's nothing on the mammogram. To have a doctor, to have someone helping you with your care is just so important.
Absolutely, and to have that baseline. So, Bershan, you beat the odds. What can you tell us about your journey, your road to wellness?
I always call it my warrior training, right? And so I just said, I'm going to do everything, right? Because I want to live. I was like, look, I got to live. This is not my journey, and this is not what's supposed to be. Mental health is so important.
Yes.
I had to get my mental health involved in this because after reading and everything, they say 90% is what you think and what you feel. So mental health is number one. That's why I literally started my You Are a Warrior app that's coming soon. You guys got to join it, yourawarrior.com. But so one is exercise. You really have to exercise. Two, you have to eat right. I'm sorry, people who have been diagnosed, you have to change your diet. You can't be having macaroni and cheese and apple pie and all of this sugar and think it's going to be helpful. It won't. Right? I literally became a vegan. I thought,
wow.
I can't give up chicken. I can't give up beef. I love a good burger. I love pizza with pepperoni. No. Stop. Right? I had to stop that. Now, I brought back fish into my diet, but for 10 years, I was a vegan. So
how many years?
10.
Okay.
Wow.
Yeah. I really, and you don't miss it. I really used to think, I don't miss it. I don't miss a burger. I don't miss pepperoni and pizza. I don't miss those things. I mean, there's so many different things that you can eat. 3, I do affirmations and manifestations every day. I affirm and write in my journal, affirmations, manifestations every day. 4, I meditate. That mental health. Remember, see, with everything, when you have your mental health, mind, body, and spirit, when you connect, it's in alignment. And it works for everything. Scientific studies, it's a fact. And when we're talking about African Americans, we don't put our mental health first. We got to work. We got to do this, take care of the kids, take care of the family, pay the bills, this and that. And so then behind us, we get sick and we keep on going and never stop and breathe. Right?
So true.
So everybody has to stop and breathe. And 5, you need a support system. You have to have a support system. So even, funny thing is, Dr. Shereef, I had gone to your hospital when I was in New York, because I live in New York and DC, and you did have some good staff. I don't know if you were there then. I mean, it was 12 years ago. And then I went to Hopkins, but you need a support system. You need people who are going to be there and support you, because when you hear the C word, you can go down a downward spiral.
Absolutely.
You get, so that's so important. And check your boobies, ladies. Know how they feel now, because I do have dense breasts. And so my breasts were some that they couldn't really tell. My mother died from breast cancer, unfortunately, 10 years before I got diagnosed.
Yes. Family history.
Yeah, exactly. And the doctor told me there's no way that I would have it that young. And he was wrong.
Isn't that interesting? I mean, so many women have it, and just the rates of diagnosis are getting more and more so. And then we know with COVID, people did not keep up with their screenings. What are your thoughts about clinical trials? And Vivica, what are you hearing about clinical trials? What are your thoughts about participation?
Well, can I tell you what I think is the most beautiful thing about what's happening in our communities is that we're finally all talking to each other. Absolutely. That it's okay for us to say there's a problem or something is going on or something doesn't feel right. Communication is key. Back in the day, everything, you'll be all right, don't worry about it. You know what I mean? So for us all to now be communicating, thank you all so much for having a summit, like today, where we talk about Black women and Black health matters for ourselves. I think that it's a start of a beautiful time of us living longer and healthier and happy lives.
Absolutely. I have to ask
my hand on clinical trials, because this is very important. I was in a clinical trial.
Good.
Yeah. And I believe in clinical trials. Here's so we as brown and Black people have to understand, yes, we have been, we've been through some bumps in the roads with clinical trials. As we all know, there are a lot of things with Tuskegee outreach and things like that. But you guys, we have to really understand about our health, and we really have to take it seriously. And clinical trials are the only way that we can learn about what works and what doesn't. We get left behind in the healthcare industry. We get left behind with knowing about us. So as you know, Dr. Shereef, I'm sure you're a doctor and Johns Hopkins University is one of the, research hospitals in the world. In that neighborhood, no one goes. No one goes to the hospital right in the neighborhood. They had to try to have me go to the outreach. I mean, they live next door. If you get sick, you wouldn't go next door. You would go 10 miles down the road or go to another. You don't go next door, which is right to you. So because we live in fear of doctors, we live in fear of mammograms. It's going to hurt. I don't want someone smushing my breast. I don't want someone touching me.
Yes.
All of these different fears, we get left behind with healthcare and we die at a higher rate. That makes me cry that when I see most Black women they have triple negative or they get stage 4 when they're diagnosed. When white women and our counterparts, they get diagnosed as stage 1. They exercise, they eat well, and it's cured. No more. We have to start joining healthcare professionals.
Yes.
Summits are amazing to start learning about it, speaking up and standing up, or we will not be here.
That's right. Truth to power. Dr. Elnahal, what do I need to think about? What do I need to look for if I've been diagnosed? What's my treatment plan? What should I expect? What's my road if I have breast cancer?
First thing I'll say is that I can't tell you how amazing it is for Ms. Shaw and Ms. Fox to be talking about clinical trials and Black women and Black men participating in them, just as a quick aside here. The reason that doctors just haven't been as good at treating so many things, not just breast cancer, in people of color is because people of color historically have been reluctant to participate in clinical trials that allow doctors to know what to do. And of course, there are good reasons for that. The history of medical racism in this country is real. And we talked about that a lot during the vaccine debates. And now we have people of color meeting or exceeding in some places vaccination rates for white folks. But these conversations are really important. In terms of your diagnosis, it's very important to follow closely with your doctor and find a doctor that you trust, because the treatment plan is going to depend entirely on something called your stage. Your stage is something that takes together imaging, it takes together the clinical diagnosis, and a whole team of folks get together and discuss you in something called a tumor board, where the radiologist is there, the medical oncologist is there, the radiation doctor, the surgeon, all discussing your case. And they decide what stage you are based on how much the cancer has progressed. And then the treatment can be a combination of many things. You can end up getting surgery, you can end up getting radiation therapy, or you can end up getting chemotherapy, but more likely a combination of at least 2 of those things, depending on what you have. There are also novel therapies that are being developed every year. We're seeing new things that are more targeted. So it's not the general chemotherapy, which can be much more toxic, but it's much more targeted to the cancer while overall keeping you healthier through the treatment. But that's the general approach.
All right, I'm going to turn it over to everyone who wants to ask questions, and we have a lot of questions here. We have a question specifically for you, Dr. Elnahal. Have you treated Black men with breast cancer?
I have, and I'm so glad you asked about that, and Ms. Fox brought it up as well. A lot of people don't know that breast cancer can happen in men and Black men as well. And in fact, breast cancer in men tends to be a lot worse. It tends to be diagnosed at a much later stage because men aren't looking for it. We don't see enough discussions about it. And for whatever reason, the biology of breast cancer in men tends to be worse. And so I'm glad that your colleague, Ms. Fox, ended up getting treated and did well. But not every man can say that. And so awareness around this, and then, of course, allowing men to be able to talk about it who do have it. It's rare, much more rare than in women. But just like we have to erase the stigma for talking about these things among Black women, doing so among Black men as well is really important.
Another question for you, Dr. Elnahal. When should Black women start to receive screenings for breast cancer? Is it earlier than what we would consider for white women? And tell us why.
So I think as a general matter, since breast cancer tends to be diagnosed early more often, consulting with your doctor is really important about this. There have been debates about whether you should start at 40, 35, 45, depending on who you ask. might disagree, but your doctor will know your risk factors the best. And in fact, your family history may warrant you getting screened in your 30s. Which is something that a lot of folks don't know. And so that's a very personal question for folks to understand. And having a doctor and discussing that with your doctor is really important.
Thank you. And we have a question about stigma. Vivica, just give it to them one more time while we have to break the stigma of
Yes.
not coming together
Mhm.
and sharing our experiences, how that is the opposite of healthy behavior. Please.
Like I said, it warms my heart now to see us all communicating, to see the chat room just light up with everyone that showed up literally all over the country means that, as a community, we are starting to communicate with each other, look out for one another, that it's okay to speak up and speak out. So, as a celebrity, it's the main reason why I'm here, that I'm going to let you all know I care about the community. I care especially about my sisters. I want you to live happy, healthy, beautiful lives. And, to have a warrior, a thriver, here with her beautiful self that has survived this thing twice. It warms my heart that I'm here today, and I'm glad that you all know that I'm going to be here for the long run too, because I've got to go get checked and make sure I do what I'm supposed to do as well.
Amen to that. No, we thank you. We thank you. Bershan, we just want to hear, we're going to give you the last word. What are you going to leave our Black Health Matters family with in terms of words of inspiration that you're going to follow, that you want us to follow, and that you want us to know?
Oh, can she not hear us?
I don't know. Let me see. Can you hear us?
There she goes. Yeah.
Okay. So we're going to give
I
you the
can hear
last
you.
word.
Can you hear me?
Yes, now we can.
Oh, thank you. I just want to say, brown and Black people, ladies and gentlemen, please check yourself. Don't be afraid. Remove this stigma. Remove the negativity of it. Cancer is not a death. I am here to tell you it's not. You can live, you can survive, and you can thrive. We're in this together, like Ms. Fox said, Vivica, Dr. Shereef. We're all in this together. If we speak up and stand up and hold each other's hand and get to learn about it, we can heal and we can get better. I don't want Black and brown people to be the highest rate in dying in cancer, the highest rate with breast cancer, prostate cancer, lung cancer, everything, diabetes. We're in this together with social media, with our health, and with our amazing doctors like Dr. Shereef. We can do this together. So let's do it together and let's win.
All right. No, that sounds fantastic. And wouldn't you all want to have a doctor like Dr. Elnahal, Dr. Shereef Elnahal?
I would.
There are doctors out there. Yes, we would. Yes. But there are many, many doctors out there who are going to be concerned about you, who will treat you like you are a family member. So don't let fear. And then again, to your point, we have wonderful cancer centers in the urban communities. We won't go down the street. If anything, Black Health Matters is telling you to advocate for yourself. Go for the best. That's what we do. That's what we want. That's who we are. Don't let cost stop you. Don't let fear stop you.
Yes.
You are stronger than all of that. You know why? Because Black Health Matters, and we're here to reinforce that.
Yes.
So thank you all for your time. Have a great day, and stay with us. We have more amazing panels coming. Take care.
Yes. That was good.